Hi, I'm Katie Adams with MedCity News, and I'm here with Kempton Presley, CEO of Adhere Health.
Nice to see you, Katie. Thanks for having me.
Well, I know that Adhere Health thinks about medication adherence a little bit differently. It's not just a set of measures, for CMS star ratings, but it's more of a predictor of a patient's overall health behavior. Can you talk about that?
Absolutely. Medication is the most frequent interaction that the patients have with the healthcare system.
Yeah.
So for us, it's a way to understand and serve as a leading indicator to all of their behaviors throughout the care continuum. Shows their level of access, shows the doctor-patient relationships, shows how they can get to pharmacies. It's a reflection of health literacy and in some cases numeracy. So it has so many different insights that it brings forth to us throughout the care continuum.
Well, we're here at Vive where there are so many digital health tools. We see the thousands here. And with there being so many now, the standard is a bit raised, I would say, in terms of ROI. Can you actually deliver value for your customer? And it seems like there's quite a bit of ROI in this medication adherence. Can you talk about how you're defining that?
Absolutely. So we sought to design and define our program in a way that looks at the long term and that could exist agnostic to the changing sands of regulatory frameworks. And so our position is that by getting someone to take their medication the right way or get off the wrong medications, that changes their entire trajectory of health. And there's a significant ROI throughout the entire spectrum and the way in which they use care after the fact. So we know that members that are adherent to their medications have fewer ER visits, they have fewer unnecessary hospitalizations, they have just a different sort of condition profile over the long haul, and that's really important and intrinsically the reason the star ratings and other types of quality ratings were designed. So being able to define that and quantify that both clinically and economically is going to be critical for sustainability.
Excellent. And I want to talk a little bit about personalization and specialization because I'm sure adherence looks a lot different in every patient population. So maybe we can talk about dual eligible members because they face a lot of layered social, clinical challenges. What does Adhere Health do to kind of effectively support that population?
Yeah, dual eligible members represent a significant portion of the members that we serve. And as a result, we've had to think about the different types of challenges that are faced by those folks that are in those types of scenarios. And in many cases, it's working through various types of social challenges, it's working through environmental challenges before we can even get to discussions about medication.
Yeah.
We know that there's affordability issues, there can be transportation and other types of access issues. We know in many cases having a PCP is a luxury to many folks. So we have to come in and be able to uncover and illuminate a lot of the different types of things that are blocking those members from getting their medications and or getting other types of screenings. So when you look at duals and try to understand them, there's so much that can be understood by their environment and being able to look at things like social vulnerability index, which is a reflection of challenges at not only the zip code level, but at the census tract level, which can tell you a lot about what each particular patient is navigating in their day-to-day life. So bringing in that context helps us to really be able to connect with patients and equip them with the different resources that they may need. It's completely, many of which can be completely independent of the medication process itself.
And all too often, those factors you described can be ignored in healthcare. So it's excellent to hear that you're paying attention to that.
We kind of have to pay attention because we go at risk for every member and the different measures that they're trying to, or the different gaps that they're trying to close. And so if you go at risk for something, you have to figure out the best ways to solve the problem and then prove that you're solving the problem. And so it really puts a lot of accountability on us and our program design to make sure that that works appropriately. So
absolutely, all about proving you're solving the problem.
That's right. That's right.
Excellent. Well, thank you so much for your insight and for being with us here today.
Oh man, it was an honor, a pleasure. Thank you all for having me.